everybody, this is Devin from the Updegraff Clinic for Allergy and Dermatology, and we're doing a video today on the laser V-beam. We're going to be doing it on Carol here. Carol has little lentigos, brown spots caused by the sun, and we're going to zap them off today. The hand, so you can see some examples of lentigos are going to be right over here. You had one on your finger, so this one right here. Those are examples of little sunspots, we call them, caused by the sun, especially in bare skin individuals. So the laser is going to see them and zap them. Here's the laser. It's going to be the Candela Vbeam. We use this laser not just for, but also for any kind of redness of the face. So a lot of people get rosacea of the cheeks, the nose, here, takes care of that. And then again, any brown spots on the face as well. So that's what we use it primarily for. And we're going to get started. So let's get going. Okay, so we have our wonderful glasses here. So we're going to give Carol some. Our wonderful assistant, Karina, since she's hanging out in the room with us, is going to be wearing them as well. Anytime we want to get a little bit more around the cheeks, you can see how these glasses block out a lot of the skin. We can use these wonderful laser eye shields and put them directly over the eye, and then that way we don't need the glasses. We can get much closer to the eye area without getting blocked a large portion of the face. But today we're just doing her arms and hands, so we really don't need to worry about these. We can use the regular glasses. This is the little setting we're going to use for the lentigos, and it just has almost like a little glass here, and it's going to magnify the lesion, and then the laser through heat is going to zap the little brown spots. She will feel it. Really, it's heat is what she'll feel. Completely tolerable. Typically with lentigos we don't use a lidocaine just because we're treating lots of them on large body surface areas. So a person may come in wanting their chest, arms, face, legs, and we can't obviously cover them in lidocaine, not just because of inconvenience and messiness, but also we don't want them absorbing that much lidocaine because they can get into some trouble when their body absorbs too much lidocaine. So when we're doing lentigos in large areas, we tend to just tell them to kind of suck it up, and it's quick, heat, zap, and they're done. And they're very comfortable when they leave the office. It's very tolerable. When we start doing areas of the face, the rosacea, the redness, it's a little bit more of a consistent zapping and also a smaller area. So with those patients, we do use a topical 20% lidocaine. Let it sit for about 20-30 minutes. That way it takes the edge off. They'll still feel the laser. It's a little bit different sensation. But they are much more in need of it than just, again, random spots that we're hitting. All right, so let me get the laser count. Okay, so we have the lasers here. The settings are put in. We have the joules, which is the power. The duration or milliseconds here is going to be the depth that laser goes to. So we're good to go. I'm just going to calibrate it here. That's the laser getting everything set up and ready to go. Okay, so it's good to go. So we have my wonderful eye shields on here, and we'll get started. You ready, Carol?
Yep.
Okay. So here we go. Okay, so she felt it. What do you think?
And not bad.
Not bad. That finger one so we don't forget. So you can see it moves quite quickly, and it's quite comfortable. It's not really horrible at all. And then the ones that we've treated, you see how they already start to darken? That's very normal. That's typical, and it tells us that the laser saw the lesion. Those will continue to darken and almost turn just a brown, darker brown. They'll in a way scab up, and then she'll find over the next 2 weeks or so that that lesion kind of flakes away. It's not going to come off in one fell swoop. It'll just flake away is the best way to describe it. Okay, let's keep going on the other hand. sometimes when the lesions have a little bit more pigment, you'll feel it a little bit more. Because again, that laser sees pigmentation. So if we're treating redness, the laser sees the red. When we're treating lentigos, it's seeing that brown discoloration. So the darker the lesion, the hotter it gets, the hotter it feels. Pretty much across the board, laser is an ideal candidate. Is going to be fair-skinned individual, and then for hair removal, for example, we want a fair-skinned individual within dark hair because again, it sees that pigmentation. If you're fair-skinned but you have really light hair, so the hair here on her arms, that wouldn't work for laser hair removal. It wouldn't be able to see it very well. Same thing with the face. Some people get laser hair removal on the face, and I've heard complaints that they tell me, well, it didn't work. Well, I could have told you it didn't work. The hair on the face is not thick or dark enough. Again, under the arms, legs, pubic area, it's going to be that darker, a little bit more coarser hair. That's what the laser is going to see much more effectively. So same thing here with this laser is the darker the spots, and then the fairer the skin, better the results. Same thing with redness. If the person's a little bit fair skin with redness, they'll respond much faster than a person with a little bit of color to their skin. And we also, with a little bit of color to the skin, we can't be quite as aggressive. We have to be a little bit more conservative with different skin types. All right.
Not bad.
I think we're good. Any others you want us to do? Okay, so that gives you an idea of what's involved with the treatment. Now, again, this is just for treatment of lentigos, those brown spots. And again, rosacea is a little bit different, but same laser. And this month, for the month of July 2017, we will be doing 20% off any Vbeam treatment. So brown spots, rosacea, redness, you name it. Also do scar treatments. So if you have a fresh scar that's very red, it works great on that as well. So call our office if you have any questions, or you even just want a consult. We can talk with you and see if you're a candidate and go over all the different options for you. Thanks for watching. Bye.